Welcome to the deep dive. Today we're tackling a really tough medical challenge. These severe, life-threatening fungal infections. They're particularly dangerous for people with, say, weakened immune systems, diabetes, or those recovering from major injuries. And even with the best antifungal drugs we've got, getting good outcomes can be, well, a real struggle.
Yeah.
So we're diving deep into a potential extra weapon here. Hyperbaric Oxygen Therapy, or HBO2.
Exactly. And despite, all the progress we've made with antifungal medications, the fact remains that many patients with these deep fungal infections still face very high risks.
Yeah.
So this deep dive, we're aiming to sort of clarify the science behind using HBO2 in these critical situations. We'll explore what the evidence suggests about how it might help, but also be, really clear about where the uncertainties are. Our goal today is really to give you a solid understanding of this whole approach.
Yeah, and we've been digging into some really interesting material, specifically chapters from the textbook Hyperbaric Medicine Practice.
That's the one, focusing specifically on this area.
Right, using hypobaric oxygen as an add-on treatment for these invasive fungal infections. Okay, so let's start with the basics then. Why are these fungal infections just so incredibly hard to beat in the first place? What makes it such an uphill battle, for the body and for the drugs we use?
Well, often these infections start quite simply. Fungal spores, they're like tiny seeds, really. They enter the body, often just through breathing them in.
Seems common enough.
It is. But the real trouble starts when these spores take root, grow, and then begin to invade the body's tissues, and crucially, our blood vessels. That invasion, that's where things can get very serious very quickly.
Because when the infection damages those blood vessels, that's when the oxygen supply starts to get choked off,
Yeah.
right, to the area.
Precisely. The infection causes tissue damage, sure, but also direct harm to the blood vessels. This cuts down the oxygen flow, creating what we call hypoxia, basically. The tissues are starved of oxygen. And this lack of oxygen, it can lead to tissue death, which is necrosis. And unfortunately, it can also create an environment where the fungus can actually spread more easily.
Wow. So it's like a vicious cycle then. The infection causes low oxygen, and that low oxygen makes it harder for the body to fight back and maybe even helps the fungus.
That's a very insightful way to put it, yeah. It is a vicious cycle. And research has shown that these low oxygen conditions, which often go hand in hand with more acidic conditions in the infected tissue, they can actually make our antifungal drugs less effective.
Really? Less effective?
Yeah, and what's more, these conditions might even give the infection a better chance to really establish itself and spread further.
That's a pretty grim picture. Okay, so how does hyperbaric oxygen therapy, HBO2, how does it try to break that cycle? What's the thinking behind using more oxygen as a, potential weapon here?
Well, the core idea, it really revolves around the vital role oxygen plays in our own defense system, and also in how some of our key antifungal drugs actually work. So first, think about our immune cells, like macrophages, neutrophils. These are our body's sort of frontline soldiers against fungi.
Right, the fighters.
Exactly. And their ability to kill these fungi, it really depends on having enough oxygen available. They use oxygen essentially to produce these toxic substances that destroy the fungi.
Okay.
So if the infected tissue is low on oxygen hypoxic, these immune cells just can't fight as effectively. It's like trying to fight a fire with just a trickle of water from the hose.
So if the tissue is starved of oxygen, these immune cells, they're just not working at full capacity.
Exactly that. Their killing power is directly linked to the amount of oxygen present. Now let's think about the drugs. One of the really important ones we use is amphotericin B, AMB for short.
A and B, okay.
What's fascinating is that lab studies have shown that AMB's effectiveness can drop significantly in some studies by as much as 80% when oxygen levels are low.
80%. Wow, that's a huge drop in how well the drug works. So we're using this powerful drug, but the infection itself creates conditions that basically slash its power.
Precisely. And this is where HBO2 offers a potential solution. By putting the patient in a special chamber and increasing the air pressure, think of it like going deep underwater, the pressure increases.
Right.
We can dramatically increase the amount of oxygen that dissolves into their blood plasma. This extra oxygen can then get delivered to those oxygen-scarved infected tissues.
Ah, I see.
And the hope is this oxygen boost will energize the immune response, let those frontline cells do their job better.
And potentially help the antifungal drugs like an AMB work better too. Is that part of it?
That's absolutely the theory. In the lab, experiments have shown that high oxygen pressures can actually slow down the growth of several common fungi, things like Candida, Aspergillus, and Mucor.
Okay.
And even more encouraging, when they combined HbO2 with AMB in lab settings, it showed a stronger effect against Candida than either one alone, an additive effect.
That sounds really promising. So the extra oxygen isn't just helping our body's defenses. It's potentially making the drugs we use more potent as well.
Exactly. And what's really interesting is that some research suggests AMB's antifungal action actually involves oxidation, a process that inherently requires oxygen.
Ah, okay.
So this could explain why it struggles in low oxygen environments. By boosting the oxygen, HbO2 might be directly helping AMB do its job. Now, it is important to say some of the pressures and treatment times used in those early lab studies, they were pretty extreme, not survivable for humans.
Right.
But they gave us those critical initial insights, those clues about the potential here.
Okay, so the lab evidence provides a pretty good rationale, a reason to think HbO2 could be beneficial. What happened when researchers moved from, Petri dishes to actual living animals? Let's talk about those animal studies.
Yes, there have been a couple of key animal studies looking into this. The first one by Barrett and colleagues used mice infected with rhizopus. That's a common fungus causing mucormycosis.
Mucormycosis, okay.
These mice got AMB, and then some also received HbO2, while others just breathed normal air alongside the AMB. Now, interestingly, while both groups getting AMB did better than the untreated mice.
As you'd expect.
Right. But there wasn't a significant difference in survival between the group getting HbO2 plus AMB and the group just getting AMB with normal air.
Huh. That's a bit disappointing, isn't it? You'd hope for a clear boost from the HbO2.
It is. Then there was a second study by Garcia Covarrubias and colleagues, also rhizopus in mice. They use a slightly higher HbO2 pressure this time. And in this case, the group getting both AMB and HbO2 did show a slightly better survival rate, and they had less fungus in their kidneys.
Okay, slight improvement.
Compared to the group with just AMB. However, like the first study, this difference wasn't statistically significant, meaning we couldn't be certain it wasn't just down to chance. So while these studies maybe hinted at a benefit, the results weren't, definitive.
So in both cases, maybe a little trend, but not strong enough evidence to really hang your hat on. Why might that be? What the weak signal?
Well, there are several pretty important limitations to keep in mind with these animal models. For one, the infections they induce in the mice were very severe, very widespread throughout the body.
Right, maybe not quite like a typical human infection starts.
Possibly not. And also, a really crucial part of treating these infections in people, especially mucormycosis, is surgically removing the infected dead tissue. That's called debridement.
They didn't do that in the mouse studies.
No, they didn't. It's just very difficult to perfectly replicate all the complexities of a human infection and its treatment in an animal model. Plus, it's worth remembering these studies used older forms of AMB. We often use newer, less toxic versions now.
That makes sense. The model isn't perfect, and maybe the treatment wasn't quite what we'd use today. Okay, so animal studies give us some clues, but maybe not the full picture. Let's move on to what we actually see in human patients. What does the clinical experience tell us about using HbO2 for these infections?
Right. So most of the clinical reports we have focus on two particularly nasty types, mucormycosis and aspergillosis. We mentioned the Garcia Covarrubias group reported some aspergillosis cases, and there was a study by Segal and colleagues that looked back retrospectively at patients with both.
Okay, what did that Segal study find?
They looked at 14 patients, 12 with mucormycosis, 2 with aspergillosis, all treated with standard antifungals and HbO2. Surgery, that debridement we mentioned, was done in most, but not all of them. They found about a 50% survival rate in this group.
50%? In these severe infections? That sounds potentially significant.
It does, but the researchers themselves were careful to point out that their study couldn't definitively prove that the HbO2 was the reason for those outcomes.
Right. It's hard to isolate one factor when people are getting multiple treatments for such complex conditions.
Exactly. It really highlights the challenge. Now, let's zoom in a bit more on mucormycosis, because that's where we see quite a bit more clinical experience reported with HbO2.
Mucormycosis, you said it's particularly dangerous. What makes it so bad?
It is. It's rare, thankfully, but incredibly aggressive, caused by fungi called mucorales. And rhizopus species are often the culprits behind the rhino-orbital cerebral form, ROCM.
Rhino-orbital cerebral. So nose, eyes, brain.
Exactly. Face, sinuses, eyes, potentially spreading right into the brain. What makes it so dangerous is its ability to invade blood vessels. Angioinvasion.
Ah, like we discussed earlier.
Right. This leads to clots, blockages, cuts off blood flow, causes tissue death, necrosis, and allows the infection to spread really, really fast.
And who's most at risk for getting this?
Typically, it's people whose immune systems are compromised in some way. People with poorly controlled diabetes, especially if they're in diabetic ketoacidosis, DKA, they're a classic high-risk group.
Okay.
But also patients with blood cancers like leukemia or lymphoma,
Mm-hmm.
organ transplant recipients, bone marrow transplant recipients, people with advanced kidney failure, especially if they're getting a drug called diferoxamine.
That iron drug you mentioned.
Yeah, it chelates iron, but somehow makes people more susceptible to mucor. It's a strange link. And also patients with major burns or severe trauma.
So a range of vulnerable individuals. And it usually starts from inhaling spores, you said.
That's the most common route, yes, especially for that RSEM form and lung infections. But it's also important to know the fungus can get in directly through injuries, traumatic implantation, especially with a specific species called Apophysomyces elegans.
Apophysomyces elegans.
Okay, and what's striking about that one is it can cause severe infections even in healthy people after a trauma if the wound gets contaminated.
Wow, that's unusual. A healthy person getting such a severe fungal infection just from an injury.
It really shows how aggressive these fungi can be given the chance. Now, looking back historically, before the 1960s, mucormycosis was almost always fatal, just devastating. The arrival of amphotericin B, AMB, and combining it with more aggressive surgery, that did improve survival rates over the following decades. But even then, many survivors had significant disabilities, and if the infection got into the brain, survival was still extremely unlikely.
So given that history and how deadly it can be, this is where HBO2 might really make a difference if it works. What have doctors actually seen when they've added it to the treatment?
Well, there are several reports, mostly individual cases or small groups of patients, that are quite suggestive. For instance, a study by Couch and colleagues described two patients. They had rhinocerebral mucormycosis, developed brain abscesses, and they were actually getting worse despite aggressive surgery and antifungal drugs. Standard care wasn't working.
Okay, so a really bad situation.
Exactly. Both patients showed significant improvement only after HBO2 was added to their treatment plan. And these cases were really noteworthy because brain involvement, especially with abscesses or a blocked internal carotid artery, historically that was almost always fatal.
That is a remarkable turnaround. To go from basically a hopeless situation to significant improvement just by adding oxygen therapy.
It really is suggestive, and there are other reports too. Successful outcomes in rhinosinusoorbital cases where HBO2 was added to surgery and antifungals, even in patients who weren't responding well initially. And remember that Apophysomyces elegans from trauma.
Yeah, and in healthy people.
There are documented cases of successful treatment using the combo approach surgery, antifungals, and HBO2 in those individuals, too.
It really sounds like in these absolute worst-case scenarios, these really tough mucormycosis cases, HBO2 might be offering something significant.
It certainly seems possible. There was a review by Yohai and colleagues looked at over 140 mucormycosis cases, and they found that using HBO2 appeared to be linked with a better prognosis, a better outlook.
Interesting.
Now, things like delays in diagnosis, certain underlying health problems, specific symptoms, those definitely made the outlook worse. But the use of hyperbaric oxygen seemed to have a positive influence overall in their analysis. And several other smaller reviews, case series, like the ones by Garcia Covarrubias and John et al., they've also reported pretty encouraging survival rates in mucormycosis patients who got HBO2. Sometimes as high as 60%, even up to 86% in one series.
Wow, 86%. That's drastically different from the historical outcomes you mentioned. It really makes you think HBO2 could be making a crucial difference, especially in those really challenging situations.
It certainly raises that important possibility, doesn't it? But we do have to temper that enthusiasm slightly. We need to remember many of these are retrospective studies.
Looking back at past cases, yeah.
Exactly. Not the gold standard randomized controlled trials where patients are randomly assigned to get HBO2 or not. And current European guidelines for managing mucormycosis, while they acknowledge HBO2 might have a role, they only give it a marginal strength recommendation, which basically reflects the need for more solid, high-quality evidence.
Okay, that makes sense. Promising signals from clinical experience, especially in mucor, but the highest level of scientific proof isn't quite there yet. What about the practical side? If a doctor decides to use HBO2 for mucormycosis, How is it typically done?
Well, given how aggressive and fast mucormycosis can be, HbO2 is often considered when a patient isn't improving despite the standard treatments.
Kind of a salvage therapy situation sometimes.
Often, yes. Though some might advocate for using it earlier, the typical treatment involves putting the patient in the hyperbaric chamber, increasing the pressure to 2.0 to 2.5 atmospheres absolute, or ATA. That's 2 to 2.5 times normal sea level pressure.
Okay.
And they breathe near 100% oxygen for maybe 90 to 120 minutes, usually once or twice a day.
And for how long? How many treatments?
That can vary a lot. The course can be quite long, sometimes many weeks. There are reports of patients getting up to 80 sessions, 80.
Wow, that's a huge commitment.
It is, and deciding when to stop is also challenging. It usually relies on monitoring things like fungal cultures, imaging scans, and just seeing clear clinical improvement in the patient.
Okay. That's a deep dive into mucormycosis.
Yeah.
What about aspergillosis? We mentioned it briefly. What's the clinical experience with HbO2 look like there? Is it similar?
Aspergillosis is another common fungal infection caused by Aspergillus species, widespread in the environment. But again, it mostly affects people with weakened immune systems, transplant recipients, cancer patients are common examples.
Right.
And similar to mucor, Aspergillus can also invade blood vessels, cause blockages, lead to hypoxia in the infected tissues, which again makes treatment harder.
Okay, same basic problem with oxygen delivery.
Exactly. However, compared to mucormycosis, there are actually fewer reported cases of invasive aspergillosis being treated with HbO2. So the amount of clinical evidence we have to draw on is even smaller.
So the evidence base is even thinner for aspergillosis than for mucor.
Yes, significantly thinner. We do have some individual case reports, like one describing an aspergillus joint infection that apparently resolved with HbO2 after surgery and antibiotics had failed.
Okay, another salvage situation.
Seems like it. And HbO2 has been used successfully as a last resort in other isolated cases, too. The Garcia-Covarrubias group did publish that retrospective study we mentioned, looking at 10 immunocompromised patients with rhinosinus aspergillosis treated with AMB, surgery, and HbO2.
And what did they find in those 10 patients?
6 of the 10 survived, which, again, in immunocompromised patients with invasive fungal infections isn't necessarily bad. But the researchers noted there was often a significant delay in starting the HbO2 therapy.
Suggesting, again, it was used late, maybe when things were looking grim.
Precisely. Suggesting it was often used as a salvage therapy, a final attempt when other things weren't working well.
Which makes it really hard to know how much the HbO2 itself contributed, right? If it's only used in the toughest cases, late in the game.
Exactly. And another really important point with the aspergillosis data is that many of these older reports involve using those older formulations of amphotericin B.
Right, you mentioned that.
Nowadays, for invasive aspergillosis, the first-line treatment is often newer antifungal drugs like voriconazole or isoguconazole. They tend to be more effective and often better tolerated.
Ah, okay. So the standard treatment itself has improved significantly.
It has, which means the potential role for adding HbO2 might be different now compared to when AMB was the only primary option.
So given that we have better primary drugs for aspergillosis now, where might HbO2 still fit in? Is there still a rationale?
Well, based on the underlying pathophysiology, the blood vessel invasion, the hypoxia.
The core problem is still there.
Right, so it might still be reasonable to consider using HbO2 perhaps early on in really severe cases, like those involving the sinuses and brain, rhinocerebral infections, or maybe in patients whose immune systems are just profoundly suppressed. The treatment protocols would likely be similar to mucormycosis initial frequent treatments at 2.0 to 2.5 ATA, then reassessment. It's worth noting, though, that using higher pressures, which are sometimes used for other conditions treated with HbO2, carries a greater risk of side effects like seizures.
Seizures. Yeah, okay.
Yeah, especially concerning if there's potential involvement of the central nervous system by the aspergillosis itself. So usually stick to those moderate pressures.
Got it. Okay, so we've covered mucormycosis and aspergillosis in quite some detail. The textbook chapters also briefly touch on HbO2 being used for a few other, even rarer fungal infections. What can we glean from those mentions?
Yeah, just a few brief reports really highlighting potential uses in difficult situations. For example, there's a case report of a rare rhinocerebral infection caused by a fungus called Candida bolus coronado. This was in a healthy person, unusually, successfully treated with HbO2 plus low-dose AMB after surgery. Interestingly, that specific fungus doesn't typically cause the same severe blood vessel invasion as mucor.
Huh. So maybe HbO2 helped in a different way there.
Possibly, or maybe it was just part of a successful multi-pronged approach. It's hard to say from one case. HBO2 has also been reported as a successful last resort treatment for some severe forms of coccidioidomycosis or valley fever.
Okay.
And there's another case of a chronic ear and bone infection, osteomyelitis, caused by Pseudocaliceria boydii. This was eradicated using HBO2 combined with an oral antifungal, but only after surgery and standard antibiotics had failed.
So again, these sound like really tough, persistent infections where HBO2 was brought in when other things weren't enough.
Exactly. They're all individual cases, these last few, so you can't draw broad conclusions. But they do sort of hint that HBO2 might have a role to play across a wider range of really severe, difficult-to-treat fungal infections, especially when standard therapies are failing.
Okay, so let's try to summarize our current understanding then, based on everything we've discussed. It seems clear these invasive fungal infections remain a really serious threat, especially for vulnerable patients. The standard approach involves tackling any underlying conditions using antifungal drugs and often surgery to remove infected tissue.
Right, the triad of care, medical management, surgical debridement, and antifungal therapy.
But HBO2 is showing potential as a valuable additional tool, an adjunctive therapy, particularly it seems for mucormycosis.
Yes, that seems to be where the signal, though not definitive, is strongest.
The animal studies, well, they were somewhat inconclusive, partly due to their limitations, right?
Correct. Difficult to perfectly model the human situation.
But the clinical reports, especially those really severe mucormycosis cases, they offer some encouraging signs, particularly when you line that up with the biological reasons why HBO2 could be helpful, that whole oxygen delivery thing.
That's a good way to put it. The underlying principle boosting oxygen to fight hypoxia, which helped immune cells and maybe the drugs too, that rationale is certainly compelling. And while, yes, much of the clinical evidence comes from smaller case series, retrospective looks, not large randomized trials, it's also important that there haven't been significant harms reported from using HBO2 specifically in this context. That's a plus.
True.
But ultimately, as we've said, more rigorous research, better studies are definitely needed to really pin down the role of HBO2 in managing these devastating infections.
Right. So the key takeaway for you listening is probably that hyperbaric oxygen therapy offers a scientifically plausible approach. It tackles that crucial problem of oxygen-starved tissues in these severe fungal infections. And this extra oxygen, it might help the body's own immune system fight back harder and potentially make certain antifungal drugs work better.
Exactly. And while the clinical experience, particularly as we stressed in mucormycosis, suggests there could be real benefits, the evidence is still developing. It's not yet conclusive. We really need those larger, well-designed studies to give us a much clearer picture of exactly where HBO2 fits best in the treatment plan and for which patients.
And finally, it's really crucial to remember this isn't some kind of, automatic decision for every patient. Deciding whether to use HBO2 needs to be done carefully on a case-by-case basis.
Yeah.
You have to consider the specific type of fungus, the patient's overall health status, how they're responding to the standard treatments already. It's complex.
Absolutely. And this leads us to, I think, a really important question for the future, maybe a provocative thought to leave our listeners with. Given how incredibly serious these invasive fungal infections can be, and given the potential for HBO2 to address this fundamental physiological problem of tissue hypoxia, how can we best design the next generation of studies? How can we get those clear answers about when HBO2 is most beneficial, and maybe even identify which specific patients are most likely to respond well? It's a complex challenge figuring that out. But considering the stakes, it's definitely one that deserves a lot more investigation.